the Apple. Store owners in New York City have the right to refuse service to customers not wearing masks. Weather arriving, and with all of us wearing masks probably through the summer and the foreseeable future, what do you need to know about staying safe with those masks? Dr. Faiqa Cheema, an infectious disease specialist from Hartford HealthCare Medical Group, joins us now. Good morning. Nice to see you again, Doctor. Thanks for your time.
Thank you for having me again, Kevin. How are you?
Doing well. Let's start, Doctor, with the why. Why are we wearing masks? It was initially said by the U.S. Surgeon General that masks weren't necessary. That has certainly changed dramatically in the last 10 weeks or so. What do we know about the importance of wearing a mask in public?
The important thing about since the pandemic has started is that things continue to evolve and change with the virus. The important information from this virus that we've learned is about 30 to approximately 45% of asymptomatic or pre-symptomatic transmission accounts for a lot of the new cases of COVID-19. Another thing that we've learned is that wearing your mask, doing physical distancing, modifying human behavior has played a very significant role in mitigating and decreasing the surge of this infection. So as we have reopened and are deciding to move forward and re-engage with life, it's important that when we're going outdoors, going to the grocery stores, that we're wearing our masks, so when we cough or sneeze or speak, we're not, exposing the other person around us or the environment around us to any infected aerosols.
Doctor, most of us are making it a habit. We're remembering to wear a mask, but often we forget maybe to put it on properly. Go over some of the basics of how to actually wear the masks the right way.
The important thing to remember is that when you're wearing a mask, it doesn't belong on your chin or your forehead. Make sure that your mouth and nose is appropriately covered. I see when I'm about that people are using bandanas to wear instead of proper masks. That's still okay as long as the bandana appropriately covers your face, your mouth, and your nose. It should be secure because you want to avoid touching the outside of your mask and contaminating the outside of the mask. So those are just basic 101s of how to wear a mask effectively when you're outdoors, making sure that you're not constantly touching it to secure it, that it remains in place once you've worn it.
What about the importance, Doctor, if there is one, of wearing gloves? When should we wear gloves? Where should we wear gloves? How important are gloves?
As an infectious disease specialist, we're not recommending that you should be wearing gloves. The reason for that is that there's a lot of cross-contamination that occurs. So, for example, you wear your gloves, you touch a handlebar, and then you do not exchange out. You continue to use the same gloves to touch other areas. You're just spreading an infection from one spot to the other and causing the virus to spread even further. So our recommendations are that when you're outdoors, be mindful that your hands are not touching the face and mouth. When you come home, wash your hands with soap and water. But if you're out and about, keep a hand sanitizer at your disposal, easy access, and use it whenever you need it.
Finally, Doctor, I think Governor Lamont, in an interview with him last week, described it as cabin fever that so many of us are suffering from. To that end, a lot of us want to do the typical summer vacation, get out of the house if we can. What would be your advice for families contemplating this?
My advice is that we need to think about how we can re-envision living alongside this virus in a way that is safe and sustainable. The idea that you will stay indoors indefinitely, waiting for the pandemic to be over, is just not realistic. Also, on the other hand, behaving like the virus does not exist and is not currently in pandemic states, and crowding bars and pools and beaches is also very reckless. We need to find a middle ground. Our approach should not be all or none. We need to make sure that we educate the public about how to re-engage with life, how to move forward, how to enjoy the summer in a way that is safe for everyone and for themselves as well. There are a lot of health benefits of being outdoors, and we know from a lot of data that has been published that the transmission of the virus is much less when you're outdoors and enjoying activities. Another point I want to make is that, wearing your mask is the most inexpensive way to prevent spread of COVID-19.
Absolutely,
It
Doctor.
is not a political.
Thank you.
It's not a political statement, and it's the safest way. And frankly, in my opinion, it's just social etiquette. It shows that you respect yourself, you respect everybody else around you, and you really understand the basic fact that humans are the main vectors of transmission of the virus.
Absolutely, Doctor. We should keep politics out of this and think of safety at all times. Dr. Faiqa Cheema from Hartford HealthCare Medical Group, we appreciate your time as always. Stay safe.
Thank you.